Here's the consent. Sign here on the electric dotted line. No, print it out for me. I want to read it. Do you know what you're signing? And these are things that you do not have to agree to these in order to be treated. You need
we don't know. Like you said, we don't read this stuff. We got to start reading.
When you sign it, you're agreeing to this. It says, I agree and understand that the facility may be a teaching facility and residents and fellows and students and all these people can participate in my care. I don't agree with that. I'm there to see a doctor who's supposed to be a licensed professional who knows what they're doing, and that's who I want to see. So I scratch through all that and I put, I do not consent. And then next it goes back to testing. And you're consenting to testing for any communicable disease in the event of an accidental exposure. Then you've automatically agreed to a COVID test. Well, you're not in there for a COVID test. And so if somebody walks in with COVID, then everybody gets to get tested because they've already tested a grapefruit and it comes back positive for COVID.
Right.
On release of info, it says, I agree and understand that the facility may release my healthcare information for payment purposes. And so people would say, yeah, this is about payment and move on. If you look further down, it says, I also authorize the release of medical information to organ transplant services.
Hell no.
Should I be identified as a potential organ donor? So the doctor will identify you as a organ donor.
Listen, I came in with my organs. I'm going out with my organ. Okay, what happened to my body, my choice? So they would record your kid?
Yes, and photographs and whatever, that would become property of the facility and they could use it for whatever purposes they wanted to use it for. And then the final two things were stuff that I actually added. I am the legal guardian for my daughter, and I will have informed consent on all medical treatment prior to agreeing and consenting to treatment. No vaccines or testing will be done without my consent. I require and request itemized list of billing for patient's name for the treatment. Yeah. And then they would have to list any kind of drug that they gave her, because once we get an itemized billing, we know of every medication that you've given her.